Hello everyone, how are you guys? So I'm live. I will also start live on Instagram so that people can join from there as well. And my entire purpose of doing this live is to solve the queries that you might have for your facial paralysis. So I'll be taking all your questions related to facial palsy today. So feel free to post your questions here. And I'm also going live on Instagram. All right. Hello, everyone on Instagram. So I'm live here today. This is just a random live which I'm doing just to solve all the questions that you have got related to facial paralysis. So if you have got any questions related to facial palsy, Bell's palsy, um, or rehabilitation for facial paralysis, feel free to post it in the comment section below. Today, I am just going to answer the questions for facial paralysis. Very similar to this, I will be also doing a live session for cerebral palsy. So I will inform about that live as well upfront so that you guys can join. But today it's mostly for facial paralysis. So we'll wait for a few people to join. Hi, Habo Meow. Hi, Gitanjali. Thank you for joining. Thank you. Okay, guys. So if you have got any questions related to facial palsy, please feel free to write. So Pratima is there. I've been affected with Bell's palsy since 9 years. Any chance for improvement? Yes, chance for improvement is there. Definitely, it's there, and you should constantly work on facial massage, facial stretching, facial exercises. That has to be done in a very gradual and progressive manner. It is not anything like you can just start any exercise and do it. When you have syncytisis, you have to be little more careful with your exercise. So definitely there is a chance, but it doesn't completely go away. It stays as a residue. Right. So I hope that answers. Shirley is there. Hi, I got Bell's palsy 2 years ago. Got it twice and ended up with nerve damage. Now I have Botox every 3 months. Yes, Shirley, that's a good strategy to go ahead. Botox helps, and Botox helps in a way in terms of keeping your facial muscles relaxed. On the non-affected side, it is also helpful in maintaining your facial symmetry. Your facial muscles and the facial movements look pretty much similar on both the sides, symmetrical basically in both the sides, and that's why it helps. Pratima is asking, I'll be shifting to Bangalore very soon. Can you share your clinic details to visit, please? Pratima, I would recommend you to download HealthQ Rehab app. I'll share the link to the app in the description. From there itself, directly you can book a slot for you to come to the clinic, and you will also get the location details from there. Tofak is there. What is difference between facial palsy and Bell's palsy? So facial palsy means facial paralysis. Now facial paralysis can happen due to stroke as well. Then it is called facial palsy. And when it's Bell's palsy, it's mostly an lower motor neuron type of facial paralysis, where your peripheral branch of your facial nerve is getting affected. Massage is enough for Bell's palsy recovery after a year. Yes, massage is the most important, but not enough. You should also do a lot of stretching and some exercises for your neck region, because the platysma muscle is one muscle which surrounds here and goes till your clavicle. Okay, this muscle is also supplied by your facial nerve. This usually gets tight, and this tightness leads to tightness in neck region and all. So if you have problem here, it affects your face. If you have problem here, it affects your neck. So it mostly commonly you have seen TM joint, and this neck area usually gets stiff, and due to which patients experience more tightness in the affected side of the face. And that's why doing massage and regular stretching exercises and overall facial articulation exercise, which we call it as a neuromuscular re-education, is very important. All right, so next question is, helps the pressure in my eye and head. Right. What causes Bell's palsy? I was never told. So Bell's palsy basically can happen due to multiple reasons. Stress is one of the common reasons. Many times the trigger of events that happens causes it. So for example, if you have got history of viral infection, flu, COVID, or any other kind of infection around the ear, that becomes a trigger. But then even though you have recovered from that, and if you travel and you expose yourself to cold environment, if you are overall fatigued, if you are stressed out, right, or else if you have a lot of cold food, those time the body's immune system drops down, and that's the time when the viruses can very easily attack your ear, and this ear infection then further damages the nerve and causes facial paralysis. EMS does not help at all in facial palsy, that too in late stages, because facial paralysis, right? The nerve move regeneration happens. EMS has got no role in nerve regeneration improvement, so you should not go ahead with EMS at all. I hope that answers your question, Athin. Um, yes, so overall, if you are watching me right now and if you are suffering from synkinesis in particular or else delayed recovery in Bell's palsy, remember one thing. Three important things that you should always work on is first is to maintain your muscles relaxation state. Your muscles are very prone to develop tightness during synkinesis. That tightness is one of the leading cause why you experience the extra movements. So you have to make sure that you massage your face on a very regular basis so that that tightness reduces. After that tightness reduction, the second thing that you need to work on your facial muscle is to work on your movement improvement, or else you can say teaching your facial muscles again how to move, because when your face muscles are not moving for a quite long period of time, they kind of tend to forget what is the right pattern of movement and how. So you have to retrain your facial muscles to move in that direction again. Thank you, Shelly, for watching from Australia. Okay, and after that you need to also work on your expressions, because what happens, face is the only area in your body which is controlled by two brain centers. One brain center is basically your logical center, which guides and learn new things every single day. And then there is another brain center which is called your emotional center. Now, what does this emotional center does is, this emotional center basically usually defines our facial expressions, which we usually do before Bell's palsy. But after Bell's palsy, there is a sudden shift, and we start depending a lot on our voluntary center, the logical center, whether I'm able to raise my eyebrows, whether I'm able to close my eyes, whether I'm able to pucker. So this kind of focus kind of it actually increases or has put this brain in a constant mode of modification, and these modified movements that you see turns out to be facial palsy. Hence it's very important that on a parallel basis you should also work on improving and focusing your emotional expressions, or is just trying to learn different ways of doing your facial expression in a very gentle manner. So that is the key for working on your facial rehabilitation when you suffer from synkinesis. We have DJ Wispy. Hi, downloaded your healthcare rehab app. Great initiative. Thank you so much. I hope you guys are liking the app. I would also like to tell you that I am offering my consultation, one-on-one consultation, just at rupees one, just to help as many people as possible through this. So my consultation hours, which I have kept open, is between 2 to 3 p.m. All right. So daily, this would be the time slots where I would be available for consultation with you guys. So make sure to download the app and connect with me so that I can hear you out and can suggest you the right way to work with your facial paralysis. Charlie is also. I ended up when I got Bell's palsy with ulcer in my eye, had to have an eye taped up and put Botox in my eyes. I understand what you went through, Shirley. It's a difficult journey, but I would recommend that don't give up. Keep working on your facial muscles. One day, definitely, your face will be better. Vijay, can I hit the gym during Bell's palsy? You can go to gym during Bell's palsy, absolutely no doubt about it. The only thing you have to consider or be careful or be cautious while you are lifting weight during facial paralysis is that when you lift weight, no, what happens is, just imagine if there is something very heavy, okay, and if I'm trying to pull it, what happens, I try to tend to overforce my facial muscles as well. So you have to be careful that you don't do that. If you can avoid that, then you can go to gym, there is no problem. problem. But if you are in early phase of Bell's palsy, then you should definitely avoid going to gym. I hope that answers your question. Okay, surgery can help the complete recovery. No, surgery does not, unfortunately, help in complete recovery. Surgeries, even though have got a good track record, but the rate of success with surgery is not that great, and that's why it is not a very common practice for facial surgeries to happen. But that doesn't mean that surgery cannot be done. Surgery is only done, or its doctors recommend surgery only when there is a very major damage that has happened to the nerve. Then what they do is they do nerve grafting, which means they take another nerve, a good nerve from other part of the face, and attach it, and then wait for that nerve to kind of take over the task. Right. When I tried to up my brow, then I felt a small bit stretching on my cheek side as well as under the lips. Yes, Satin, that's what a synkinesis. Synkinesis causes height Pallavi. Synkinesis causes this. This is because of weak muscle to an extent, and whenever the muscles are weak, what happens is there are extra movements. The muscles are trying to take help from the other face area, all right, and then you experience this. So hence it's important that you gradually do gentle facial movements whenever you're doing it. Massage your face on a very regular basis. Then the next question is from Abhineet Verma. Got diagnosed with Bell's palsy 10 days back. I only have left eye movement. When I try face movement, I can feel slight movement, but can't really move it in real. Should I continue trying? No, you should absolutely not continue trying. Abhineet, I would urge you, you can download our Health Q Rehab app and you can take an one-on-one consultation with me. It's just at rupees one, but I would be in a much better position to help you and tell you what you should do and what you should avoid in this situation, because early phase is the preventive phase. You can prevent a lot of secondary complication of Bell's palsy if you are in early phase. All right, so make sure to download the app and connect with me. DJ Wispy, I suffered acoustic neuroma 3 years back, got operated, and unfortunately suffered from facial paralysis. Really sorry to hear that, DJ. Movement is there, but symmetry is lost to great extent. Also, there is watering from eyes. Anyway, I can help with watering. Watering of eyes is again a sign of synkinesis. If your facial muscles, the oral muscles, have not gained good amount of movement, then the watering issue will happen. So, if you really want to correct your eye watering, then you really need to work on your oral muscles, make them relax, and do a lot of articulation exercises, but in a very gentle and gradual manner to get better outcome. Okay, so there were few people who asked for request to join. Unfortunately, that I won't be able to do as of now because I'm parallelly taking calls, questions from Instagram as well as YouTube. Ma'am, is that good use of face massager like vibrator? No, I would not recommend you to use face massager or vibrator. But what I will recommend you guys is to use this gua sha tool. So this is called gua sha stone. I'll just show you guys. So this you can get it very easily from Amazon or Flipkart, anywhere. Okay, so this stone can be used for massage, and even this is a jade roller. So this is basically to improve your lymphatic drainage. So whenever you want to drain out excess fluid, usually people develop swelling around the eyes in this area, right? So at that time, you can just do this kind of massage in a very gentle manner to drain out that excess fluid. All right, so this is you should do. And for the tight areas where you have a lot of tightness, for example in neck region, you should do this gua sha tool in this way. Okay, so this is how it helps. So this is some kind of massager that I would recommend you guys. What happens when synkinesis person not able to do facial exercises? If synkinesis person is not doing facial exercises, what will happen is the muscles kind of tend to forget the right pattern of movements. So your wrong pattern that is developed in synkinesis kind of slowly overpowers. So it's very important that your facial muscles needs to be trained and taught that okay, this is the right way of moving. All right, so then the next question is, hi ma'am, I'm suffering from Bell's palsy almost 10 months, not yet cured. um, so I think Radha, you can also download the Health Q Rehab app. I would be able to connect with you one on one, and I would be able to help you further. The consultation fee right now, what I'm charging is just rupees one, so I would be able to hear you out. Please download the app. Okay, so this is called Guasha tool, and this is called Jade Roller. Right? Okay, I'm suffering from Bell's palsy for 10 months now, not yet got what to do. See, there is one thing that nerves, no, even though they are slow in recovery, but still they recover slowly, slowly. There are some gradual improvement that you will see over a period of time. But definitely the nerve will not be exactly the same of strength and of thickness as it was before your Bell's palsy. So that is a hard fact that you have to consider. But at the same time, you should encourage using your face in a very consistent and gentle manner, and making sure that you are mentally well. Okay, don't get depressed, don't get sad, because that will put a toll on your facial movements. Okay, so let your emotional center be as happy as possible. Prince Abdullah, I want to say thank you. Your videos has helped me so much. I got Bell's Pulse 17th of January to your videos has helped me record 75. Thank you so much that my videos helped you. Because I'm suffering from synkinesis for last 3 years. I downloaded. Thank you, Atin. Vijay Satyarthi, hello ma'am. I was in middle of supplementation when I was diagnosed with Bell's palsy. I've been taking fat burner and pre-workouts. Can I continue taking fat burners which has high caffeine content? Caffeine is something that you should avoid if you are in the early stage of Bell's palsy, because it is not something that has a good impact. But apart from that, you can take your like, see, pre-workouts and all. This is not something that is that great. Do regular exercise like walking, um, or simple cardio. Those things are fine, but don't go ahead with this fat burner, and that is not something that's good for your health. Mohammed, ma'am, which type of current either see, hemiplegia, paraplegia depends like what area of the face you're like of the body you're talking about. If the movements have returned back, or else if the movements are better, then you can go for Faraday. But if there is absolute paralysis, then you should go for this galvanic current. I have 3 years and face at 70%. What can I do? No, there has been no improvement with some time. See, when you have no improvement, right, you anyways also cannot do anything to speed up the improvement process on your facial nerve. Okay, the facial nerve will regenerate at its own speed. What you can do instead is you need to take care of your facial muscles which are paralyzed. You need to take care of the joints which are near to this area, for example your TM joint, your neck region, because that usually gets stiff, and that stiffness actually increases the problem. So take care, good care of your facial muscles, take good care of your joint by doing regular massaging, regular neck facial exercise, regular facial exercise. But that too, see, facial exercise for synkinesis are very different from the facial exercise in the early phase. So just don't follow a random video. I would recommend you take help and then only do kinesis exercises. Vivek Soni, ma'am, I'm taking twice therapy in a day. Is it good? If you're taking electrical stimulation, definitely it's not good. Please stop doing that. It is going to harm your face, not going to do good, because electrical stimulation has no role in faster nerve regeneration. Okay, it just stimulates the facial nerve artificially, which usually is not required in the early phase of Bell's palsy or not in the late cases, because our facial muscles are very different from the other muscles of the body. Okay, so they directly connect over the skin. So even though you are not using this face muscle, if you're using the other side of the face, they are constantly being moved. Okay, so there won't be lack of blood supply. There won't be very high chance of atrophy or shrinking of the muscle. Okay, so just don't think that taking electrical stimulation for 2 or 3 times is going to help you. No, it's not going to help you out. Mary is asking, I have Bell's palsy for almost a year. I can feel some muscles in my eyes. Feel some muscles in my eyes. I didn't got your question, Mary. Sandhya, my smile is not coming. 2 years over now. What to do, ma'am? Please tell me. If your smile is not coming, first thing you need to figure out which muscles are tight and pulling. Uh, pulling your facial muscles, the smile muscles in wrong direction. Okay, mostly what happens when you have synkinesis or delayed recovery, there's a lot of tightness from the platysma and the lower movement. Okay, so this are also contracting and they are not allowing the smile muscle to move in the efficient way. So we need to first release these muscles. We need to remove the tightness in this area and then work on the activation. So that's the process. Synkinesis management is a long-term process. It never ever goes away in just 1 or 2 months. It doesn't work that way. Okay, so you have to be patient and constantly work. And the third thing, please, please, please stay emotionally strong, stay emotionally happy. I know it's difficult to say, sorry, it's easy to say, but difficult to do. But if you really practice this, and I've seen this with my patients, and they themselves have observed this, that whenever they forget that there is any problem in the face and they move on in the life, they have much better recovery, much better facial expression compared to the time when they were very much worried and we were very super focused on the face muscles. So that's the conclusion that I would like to make through this live video session, that please let go these facial muscles, make them as relaxed as possible. They need more relaxation than overworking. I hope this makes sense to you guys. Okay, all right. Okay, then I think all the questions are done. I could answer as many as I can. You are my motivation. Stay positive. Thank you so much, Gitanjali. Um, Thank you, Vijay. I hope you found this helpful. Guys, one more request to you. Please make sure to download Health Q Rehab app. Please show your love and do take reach out to me. Do take a consultation with me. It's just at rupees one, and I would be love to help you out further here. Once a day is good. When I'm moving my face, I can feel some nerves around my eyes. Those are not nerves, Mary. Those are basically extra movements that you feel. Okay, so the problem is they are overactive, and those they require relaxation. All right, guys. So I hope I could answer as many questions as I can. I will try to come more frequently. And all right, bye bye. Take care.